Hello and welcome. Today we're diving deep into a condition affecting the urinary system, ectopic ureter. We'll explore what it is, why it happens, and how it's managed. So, let's get started. Ectopic ureter, at its core, is a developmental anomaly. This means it's a birth defect. Normally, the ureters, which are the tubes carrying urine from the kidneys to the bladder, connect directly into the bladder. In ectopic ureter, however, one or both ureters connect somewhere else. This somewhere else can vary depending on the individual, but it's usually further down the urinary tract, often beyond the bladder neck. The exact causes of this abnormal development are not fully understood. It's believed to be multifactorial, meaning a combination of genetic predisposition and environmental influences during fetal development likely play a role. Let's understand the pathophysiology of this condition. The crucial thing to remember is the abnormal insertion point of the ureter. Because the ureter doesn't enter the bladder at its intended location, the normal mechanisms for preventing urine reflux, the backward flow of urine, are often compromised. This can lead to vesicoureteral reflux, where urine flows back up the ureter towards the kidney, potentially causing kidney infections and damage over time. Additionally, in females, when the ureter inserts beyond the bladder sphincter, it can lead to persistent urinary incontinence, as urine constantly leaks from the ectopic opening. Ectopic ureter is not particularly common, but it's also not extremely rare. It's diagnosed more frequently in females than in males, often due to the more obvious symptom of continuous urinary incontinence. While exact prevalence data varies across different studies, it's estimated to occur in about 1 in 2,000 to 1 in 4,000 live births. It's also more commonly associated with other congenital abnormalities of the urinary tract, such as duplicated ureters, where a single kidney has 2 ureters instead of 1. The signs and symptoms of ectopic ureter depend greatly on where the ureter inserts. In females, continuous urinary incontinence is the hallmark symptom. This means constant dribbling of urine, even when they are otherwise toilet-trained. Males, on the other hand, might not exhibit obvious incontinence, as the ectopic ureter often inserts into the urethra above the external sphincter, or into the vas deferens or seminal vesicles. In both sexes, recurring urinary tract infections are a common sign, especially if associated with vesicoureteral reflux. These infections can present with fever, abdominal pain, and painful urination. In severe cases, kidney damage can lead to hypertension or even kidney failure. Diagnosis of ectopic ureter typically involves a combination of imaging and clinical evaluation. A thorough medical history and physical exam are the first steps. Ultrasound is often used as an initial screening tool to visualize the kidneys and bladder. Voiding cystoretrogram, or VCUG, a special X-ray taken while urinating, can help identify vesicoureteral reflux. However, the most definitive diagnostic tool is often a cystoscopy, where a small camera is inserted to the urethra to visualize the bladder and look for the ectopic ureteral opening. CT scans or MREs can also be used to delineate the anatomy of the urinary tract in more detail, especially in complex cases. Ectopic ureters can be classified based on several factors, primarily the location of the ectopic insertion. We can talk about intravesical versus extravesical ectopic ureters, depending on whether they enter the bladder or outside of it, respectively. Another important distinction is whether the ectopic ureter is associated with a single system or a duplicated system. In a duplicated system, one ureter drains the upper pole of the kidney and the other the lower pole. When associated with duplication, the ureter draining the upper pole is more likely to be ectopic. The primary goal of treatment is to correct the abnormal anatomy and prevent long-term complications like kidney damage and urinary incontinence. Surgical intervention is usually required. Several surgical options exist, and the choice depends on the location of the ectopic ureter and the overall condition of the kidney. Ureteral reimplantation involves surgically detaching the ectopic ureter and reattaching it to the bladder in the correct location. Ureterostomy involves connecting the ectopic ureter to the normally positioned ureter. In cases where the kidney segment drained by the ectopic ureter is severely damaged, a partial nephrectomy, or removal of that portion of the kidney, might be necessary. After surgery, follow-up is important to monitor kidney function and ensure the repair is successful. Unfortunately, because ectopic ureter is a congenital defect, there's no known way to completely prevent it. However, adequate prenatal care, including folic acid supplementation, can help reduce the risk of birth defects in general. Avoiding exposure to known teratogens, substances that can cause birth defects during pregnancy, is also crucial. The prognosis for individuals with ectopic ureter is generally good, especially with early diagnosis and prompt treatment. Surgical correction can often resolve the symptoms of incontinence and prevent further kidney damage. However, long-term follow-up is essential to monitor kidney function and watch for any potential complications. Recent research focuses on improving surgical techniques to minimize complications and optimize long-term outcomes. Genetic studies are also underway to better understand the underlying causes of ectopic ureter, which could one day lead to preventative measures or earlier detection. That's all for today's overview of ectopic ureter. Thank you for watching.